Hi everyone and welcome to BOHECO. As part of our endeavors to grow as an organization at the cusp of cannabis and hemp in India, we get hundreds of queries from patients and users about how cannabis medicines are safe, in what conditions can they be used, at what age groups they can be used. And we realized it's about time that we plugged in a senior medical expert to help answer all your questions. And that's why I'm here today and very happy to welcome Dr. Dilip Pawar. Hi, welcome, sir. A quick background and introduction about Dr. Pawar for all our viewers. He's an MBBS, an MD, a PhD, and a Harvard scholar. I would say a holy quadrant in medicine and healthcare, if I were to say so. And the goal of this discussion, Dr. Pawar, just to establish, is to help educate our viewers, patients, and users about how cannabis-based medicines can be used in different therapeutic settings. Keeping this in mind, Dr. Pawar, I'd like to start off at a place close to your heart, the space of cancer or oncology. As you know very well, that 70 to 80% of patients with cancer globally have moderate to severe pain. And recently, I'm sure you would have read an article that in India alone, we have 10 million new patients for palliative care every single year, out of which only 4% get access to opioids to manage their pain or NSAIDs where they could actually make a difference and impact. As a result, a lot of patients are facing side effects, facing lack of access to medicines, and are living a life with a lot of despair. Keeping this in mind, Dr. Pawar, can you help us understand how cannabis-based medicines could play a vital role in the future of pain management in cancer and oncology-based settings?
First, let us understand pain in cancer patients. Now, let us see some statistics in India. Around 68% of patients having cancer will go through pain. Out of that, majority of them will not get complete relief from the cancer. And as you rightly point out, the palliative medicine or the palliative care, which is actually taking care of the patient at the later stage of the cancer. And what we know, stage 4 cancer patient, when they have pain, around 98% patients do not have access for pain medication.
Wow.
So indeed, it is a big unmet medical need. And I would like to say the cannabis-based medicines probably are a boon, which is actually a good adjuvant in the management of pain therapy. Now briefly, there are two parts of this. One is THC, one is CBD. Now one THC will take care of the pain and CBD will take care of the inflammation. Now you have to understand, whenever there is a cancer, there will be some sort of inflammation, and both together will give rise to pain. So if you have to control the pain, then we have to act at both the levels, central as well as peripheral. That's why I'm saying the CBN will be a good adjuvant in the management of cancer pain.
Very interesting, Dr. Pawar. I think something that you know very well, that in the world of medicine, there are anti-inflammatory drugs and then there are painkillers. Both of them operate differently for different purposes. But with cannabis-based medicines, it blurs the line, as you said, where one compound works on your pain perception, other works on your inflammation. Can you highlight this a bit more? And in terms of the potential of these cannabis-based medicines to have a dual role in actually serving patients dealing with pain-related issues.
As you rightly said, we have some medicines will take care of the central origin of pain, and we have some medicine will take care of the inflammation. But we don't have many medicines will work on both. Now we have strong pain medications like opioids, but use side effects. Whenever we prescribe this opioid-based medicine, we have to already include other medication which take care of the side effects and the complication. Now we are trying to understand the cannabinoid has two sets of receptors. One is the central receptors, which is situated at the level of brain and the nervous system, or we call it the central nervous system, and receptor CB2, which is at the peripheral level. That means peripheral tissues and immune system. Now here how it acts. At the central level at receptor 1, they will block the pain sensations, thereby reducing the pain. And the peripheral level, where it is a tissue level. Now try to understand, when we have cancer, that means it's going to damage the tissue. Whenever there is a damage to the tissue, there will be inflammation. Whenever there are inflammation, the nerve ending gets stimulated and there will be the pain. So if I am taking care at the peripheral level of the inflammation, so in combination, there will be a good effect in managing overall pain for the cancer patient.
I think this is fascinating, Dr. Pawar, and I think what holds true even more is one reality you and I accept, that the endocannabinoid system of cannabis or cannabinoid receptors in the body has been quite understudied in Indian medical history.
Right.
But what's quite unique and unusual is that two compounds alone working on the biological receptors in your body,
right,
the two compounds THC and CBD, are helping with pain, they're helping with appetite, nausea, mood, sedation, and a host of other areas. Don't you find this fascinating? And can you highlight this a bit more of how you see the role of cannabinoids working on this multi-purpose function in patients who are in need not just of one factor to alleviate, but all factors across?
Yeah, very right question, and I'm glad that you asked it. Now try to understand, when we are treating a patient, we have to treat a patient as a whole. I cannot say, okay, I am going to take care of pain, for inflammation, don't come to me, or I am going to treat this and don't come for the complication. Now, as I said, the cannabinoid-based medicine has two parts. One is THC and one is cannabinoids. As I said, there are two sets of receptors. The THC, which is the responsible for the high or psychoactive activity, that is because of THC. It will act via the central level, via the receptors CB1, what we discussed earlier. So it will try to block, reducing the pain perception for the patient. Now the cannabinoid will act peripheral level via receptor 2. Now what is the role of this? As I said, whenever the cancer happens at the peripheral level, there is a tissue level. So there is damage to the tissue. Whenever there is damage to the tissue, there will be inflammation. Whenever there are inflammation, there will be inflammatory markers which will come out. This will give rise to pain. This will also damage to the nerves and the nerve endings, which will again increase the pain. And that's why pain management is not easy in oncology patient. Moreover, at receptor level 2, when it blocks, it also takes care of the immune modulation, thereby reducing the immune response. And many times you find in cancer patients there is tremendous immune responses.
That's right.
So overall, if you see, by the THC and cannabinoid, we try to take care of both the receptors which are situated at the central level and which are situated at the peripheral level. Thereby, what it does, we reduces pain, we reduces nausea. At the same time, we stimulate appetite. We know in many of the cancer patients, the appetite goes down, thereby further making them weak. So it increases appetite. Okay. Whereas peripheral level is going to reduce inflammation. Moreover, it will reduces anxiety, which is very important effect of this product, and patient will have good sleep. So if you see, overall the benefit for the patient is very high. And most importantly, the adverse event what we see with the other standard medication like strong opioids and all, which is not seen with this medication. That's why if you combine this as an adjuvant, it will be a big boon to the patient.
I think you make an excellent point, Dr. Pawar, and honestly, I see, and us at BOHECO see the same copy of this image across the world. For example, in Israel, just a quick example, they have integrated medical cannabis and cannabinoids into their oncology setup with such perfection that it's now not even a second thought of whether this should be an adjuvant. where patients are walking out post chemotherapy
Yeah.
with neuropathy and dealing with the tingling and pain sensation in their fingers and toes. Unfortunately, other therapies and molecules and drugs are not able to do the job as well as cannabinoids or medical cannabis preparations. And this is the same image that we are seeing reflected not just in Israel, but now Germany, Canada, the United States, Australia, and a host of other countries that are viewing this with a lot of precision in terms of how this can be the next strategic adjuvant to oncological care and pain management, along with quality of life factors as well. So, Dr. Pawar, as we know that globally world over, when we use medicines, we use them in fixed dose combinations, in capsules and hard-coated tablets, for example. But with cannabinoids, as you understand well, it's very different. That's why doctors, even globally, when they are providing cannabis medicines to their patients, they're constantly titrating the dose, practically like tuning forks, to optimize it for their patients' needs. Can you help us understand this a bit more in detail about how these cannabinoids work in isolation or in combination with existing therapies, lines of treatments, and lifestyles for patients?
Yeah, very apt question. As I've been always telling, that each patient is different and the tolerance for pain is different for different patients. So you cannot generalize. Further, you cannot generalize the same dose will be apt for that patient. I'll give a very classical example. In some of our patients in clinical practice, opioid doesn't work for that. And we always say opioid means it will take care of all the pain of the patient.
Right.
So it doesn't work for them. But paracetamol works very well for them, which is a mild analgesic.
Wow.
So that's why each patient will be different. And titration becomes very important in clinical management. So you have to titrate the patient. So we have products like which has a balanced THC and CBD. So if it's suiting the patient, we can definitely use them. But you always start with a lower dose and then increase the dose. But somewhere you find if the psychosomatic effect or patient is feeling more high, then you use the medication which has dominant CBD. So you'll have to actually balance and you have to actually see the patient and titrate the dose till we get more therapeutic benefit and less side effects. That's how the clinical practice is all about.
This is fascinating, especially to understand it from someone who's worked at the forefront of it for decades and see firsthand how practical application of this knowledge for a new type of medicine, a plant-based medicine, needs evolution, needs titration, and needs cooperation with your patients to achieve this as well. If you enjoyed the information in this episode, make sure to leave your questions in the comments and we'll do our very best to answer them in the best way possible for the future and for days to come, to make sure that you make the best decisions using cannabis-based medicines for your health, your wellness, and your lifestyle.